So when you want to assess the economic impact of a disease, you have to take into account, on the one hand, let's say the cost induced by the disease, such as, for example, the treatment of sick animals, but also the cost induced by the prevention that you would like to implement to control the disease, so such as, for example, vaccination or biosecurity actions. But on the other hand, you have also to take into account the losses which are induced by the infection or the disease. So, for example, for BVD, it could consist in decreased milk production, decreased fertility, premature culling, etc. And as a rule of thumb, we can consider that losses exceed from far costs. So if we try to describe the components, for example, of cost relating to BVD, so for sure we have the treatment of sick animals, and it will depend on the morbidity for sure. But first, you have also to take into consideration the cost of the diagnosis, which initially lead to the confirmation of BVD, and then you have the cost of all the control actions such as vaccination, test at introduction to prevent the introduction of the virus and so on. And regarding the losses, you have for sure premature culling, decreased milk production, increase of somatic cell count, the increase of days open, and putative restriction regarding the movements of animals. And I think that today but these costs are already at earth level, and I think that nowadays we have also to take into account for economic impact the fact that many countries or areas try to develop control plans at national or regional level, and then some additional costs have to be taken into account to have a precise cost-benefit analysis of such plan. So for instance, we should take into account the cost induced by the organization of safe trade of animals between herds first, the constitution, for example, of database, but also the communication scheme towards the farmers. And today we have very few data about the precise economic impact of BVD in herds, but some recent study based on modeling estimate that for a beef herd we can estimate, depending if the infection is severe or not, that the economic impact for a given cow is between maybe 15 and 25 euro per cow, while for dairy herds of 40 lactating cows producing on average 7,500 kilos of milk, the economic impact could be estimated between 15 and up to 50 euro per 1,000 liters of milk, depending if the infection is severe or not.